This is Great Lean Leaders Making the Business Case. I'm Dr. Shannon Flummerfelt, and I'm so pleased to have here with us today for her round two contributions, Dr. Margaret Dimond. She is the president of the University of Michigan Health Regional Network. Welcome, Margaret. It's great to have you.
Thank you. Thank you for having me.
Yeah, so let's start with a question. And you had talked a little bit about this in your round one discussion that we had about the importance of going to Gemba and so on. I want to just explore this idea of data-driven decision making and what does that look like? And I know, when we go to Gemba, you get data from Gemba for sure, both observable, clinical, qualitative, and quantitative data. But can you explain to the listeners how, what is the value of data-driven decision making and the process that you use? Because, once you get the data, what do you do? What do you do with it? If you see something at Gemba or you're reading a report or whatever it might be, someone comes in and tells you something. What do you do with that? How does the actual process work? So tell us about data-driven decision making, and then how you go about making decisions based on data.
So just a backdrop in terms of how important it is to be data-driven in healthcare if you're a leader. Healthcare was not as regulated as it is now. And also the payments from third parties. So for instance, Medicaid, Medicare, Blue Cross, other insurers, was not tied to quality metrics. It wasn't tied to what I would call high risk metrics, like wrong site surgery and those types of things. And then in our industry, Dr. Donald Berwick came along and really started saying, how come healthcare cannot be like the airlines where it's zero defect, right? And you have a checklist and you have an algorithm and you don't deviate from that checklist no matter what. And so healthcare began to evolve into looking at pathways. What are the best pathways that have what I would call reliability, 100% reliability, or at least 95% reliability. So healthcare has really changed from, I think, I feel, I'm going to do it once. I'm going to learn it once. I'm going to teach it once. I'm going to do it once, and then I'll teach it once. To no, we need data and we need numbers and frequencies. And then we have to look at the outliers. So we want to get from a bad outcome to a near miss. So healthcare is really highly regulated. So now our payments are based on safety, quality, mortality, and then also outcome tracking. So and now it's public. All of our indices are public. Medicare requires, for instance, if we are there, they pay us based on patient experience scores. So if our quality is great, but our patient experience is very low, we'll get paid less. So it motivates the healthcare folks to look at, okay, what are the data indices? And then how do we place structure, process, and outcome around those goals of what data points to hit?
Yeah, I think that's really incredible. And of course, we see great advancements in data science, within healthcare, which is just going to be is amazing now. It's going to continue to get even better for us, I think, in terms of those issues as well. So how do you mentioned, the process and the structure and so on. What does the process of decision making look like? And, in that process, chances are you'll have people who may look at the data in a couple of different ways and have differing opinions. How do you handle that? So what is your process like? How, collaborative is it? Or, does it cascade down and, report back up? Or, what does that look like? Can you tell us what that means to you when you have all these highly regulated, compliance-driven metrics? You have to hit them, and you have better and better data reporting. But the problem solving, the solution, may not be quite as obvious, as the data points might show. So how does that work for you?
So I will say that at the governance level, at the highest levels of governance, all of our required safety, quality, patient outcome indices are shared on a regular basis. And they are trending in terms of where we're falling below the highest, decile in terms of our ratings, some of our, I guess, what I would say is deviation from the goal, and then the reasons why. So if you think about it, in my situation now, our system was acquired by the University of Michigan. The University of Michigan healthcare is #1 in the state in terms of quality, safety, and reliability, in top 20 in the United States. So imagine now overlaying their infrastructure on a community health system and how we have to raise all boats, which is great, right? But I would say to you that perhaps what we were doing as a standalone system and now what we're doing in terms of the University of Michigan requirements are vastly different. The University of Michigan has algorithms and expectations that if you have a slight deviation, there is literally kind of a real-time PDCA, like what is going on, what's the causal factor, we need to move on this, the radar immediately.
Mhm.
So I would say, again, if I had to be quite honest and unvarnished, the expectations when you get whoever the governing body is, so for me, the University of Michigan, not just a board, then if you're not meeting the expectations, then whatever that team is will be replaced by someone who can. So
Mm.
you need to go out of the box saying, we're going to hit the highest quality. We're going to hire the docs that are, they have a reputation of doing 300 of these a week or a month. And, their error rate is just a decimal point of 0.0 kind of thing.
Yeah, I mean, I think that's really interesting because, your ability to manage the knowledge, that comes from the analysis, the algorithms, the predictive analytics, and so on, it gets heightened. And when you have better knowledge management, you will have better performance management. And, when these systems can help provide some of that, it's really wonderful. And not only that, but like you say, give you insights into the intervention and the steps that need to take place. So that's very, very exciting. So when you think about this, and you've got now this system, like you say, that you have been absorbed into this larger system. So there must be some things you could share with us about successful communication. I mean, even sometimes in the smallest of entrepreneurial startups, communication between, like, if there's two partners, or if there's, an administrative assistant and, salespeople or whatever there might be, sometimes communication, even the smallest organizations, can be very difficult. So what would you say are your keys to successful communication, and how do your lean tools play into that? Are they helpful in the communication that you're trying to accomplish with employees, teams, stakeholders, and so on?
So we've really hardwired the whole process of communication around what I would call lean thinking, and then zero defect thinking as well. So every morning it's a mandatory meeting of every manager in the hospital. I'll use the hospital as an example, Sparrow Hospital in Lansing, 8:30 to 9 o'clock, and then if needed, go beyond. But every department reports out on the indices that we've given to them in terms of patient falls, patient discharge, the wrong medication administration from pharmacy, even down to housekeeping in terms of rooms that weren't cleaned in the threshold of time that they need to be cleaned on. So everyone holds everyone else accountable in that meeting. And then when the meeting ends, if there are outliers, those folks stay on the call, and we talk about, you've reported this for the last 3 days. We need a rapid cycle change on this. and you need to report out by end of day today what that rapid cycle change is. So again, the accountability, but it's equal accountability. We're not pointing
Mm,
fingers at
yeah.
anyone. This is looking at process and how do you improve the process rather than, oh, gee, Joe, you're the pharmacy chair and you've had, or chair of pharmacy or department lead of pharmacy, and you've had 3 medication errors with your pharmacist this week. It's not that. It is, we've had 3 medication errors. Let's look at the causal reasons.
Mhm.
Is it done in the pharmacy? Is it, how did it happen? What
Mhm.
were the circumstances, and what is the change that needs to occur immediately? And then how do you track that change? So using metrics of the lean process to say, okay, we identified it. Here's the causal factors. Here's the solution. So let's track to make sure that we're moving towards a stable process again.
I think that's really great. So can you share with us one of your best communication moments, perhaps one of your worst communication moments, to help us understand what you've learned? Because this frequency, the shared accountability, the collaboration, the accessibility, all of that are just are so critical. I think what you're telling us here in terms of having successful communication systems in an organization. So a best moment, a worst moment, anything you can share with us on either one of those?
Well, I would say, all of healthcare was affected by COVID. Um, and we didn't know what to do. We didn't know where it came. I mean, we were going day by day. But one of the best moments that I feel like we saved a lot of lives with is one of the anesthesiologists said, we've stopped elective surgeries, but we're a trauma center and we're still doing emergent surgeries. But I'm worried about the patient aspiration because, as you put patients to sleep, they're still breathing in the tube and there's aspirations that
Mhm.
the staff are exposed to. And he and the other anesthesiologists figured out a way to cover the patient where it wasn't having what we would call micro aspirations to the folks that were in the room. And yes, they had masks on, but that's only 80% coverage.
Sure, sure.
So, and our hospital had one of the lowest, what I would call operative team, COVID, acquisition rates in almost the state of Michigan, or at least in the county that I was in. And our idea spread throughout the system I was in.
Oh, isn't that wonderful? And of course, how does that happen? When people are free to share and they have an ability, there's a protocol to share those ideas. What a wonderful thing. I mean, that in itself probably saved lives, right?
It did. It
Yeah.
did. I mean, that there were some very innovative things that we were able to do, that helped, as you said, save lives and move forward.
That's wonderful. Is there any other example of, where when you look back, you say, wow, that was a communication guffaw for me. Is there anything that you can share in your history there that would help others?
Uh, there's so many. I think culture trumps everything, right?
Yeah.
So when you go from one environment to another, or one business to another, when you've seen one in terms of a culture. In one of my sort of low moments, I came from an organization that was very involved with safety and quality, and the team were aligned. We shared celebrations when we had a win, and went to another organization where I was the actual 4th CEO in one calendar year.
Oh
So
my goodness.
a
Oh,
lot of disruption, not a lot of staff cohesiveness, poor quality scores, and just not a good reputation. So they brought me in to help turn it around. And one of my earliest, I would say, embarrassment is, I went to the safety huddle and it was very loose. And I said, well, wait a minute. Okay, I'm hearing this, but we've got to follow up on this. So, why don't you group A go offline today and come back tomorrow for safety huddle and give us some data on, where we should be with this. So the next day they came back and they weren't ready. And so this is where culture trumps metrics, trumps quality, trumps everything. They basically said, we've had 4 of you here where you're the 4th in 1 year, so we're just going to wait you out. So
Oh, wow. And you
again,
can't blame them. I mean, that was rational, right?
right, talk about a communication expectation and guffaw. So it really talks about how people are bought in, like viscerally bought in to what you're doing. And if they're not, they're going to fudge the data. They're not going to give you what you want, and you're not going to get alignment around that goal. So I think but again, that's why you use the metrics, because it's not about the people. It's not about the culture. We're
Mhm.
here to serve patients. How can we do that in the best manner? And then what's the best metric to track how we're doing against ourselves and against national standards?
Yeah, I think that's really great. That's very powerful. And I mean, some of this stuff maybe, when you step back and look at it, say, well, why did someone do that or say that, or why did the process work like that? Well, there was probably a method to that madness, as we say, at one point in time, and so it does take a beat to get culture right, for sure. So thanks for sharing that with us. You mentioned the need for zero defect thinking around the communication system, making sure that that's very tight, and you do that through your daily huddles, and the shared reporting that you do, and so on. Um, would you talk with us a little bit about the impact of zero defect thinking? Something that I consider a part of critical thinking. So zero defect thinking, systems thinking, all those kinds of um, cognitive habits that we may or may not have individually and organizationally. So what does that look like to you, zero defect thinking? And, you mentioned culture. So I think that's another important part of zero defect thinking, for someone to feel safe enough to be the critic, play the devil's advocate, as we might say, for something that maybe has been routinized and widely accepted. So how do you go about doing that? Like fostering zero defect thinking, making sure that there's comfort and safety for people to be able to think outside of the box and put something forward maybe that hasn't been put out before.
So I'll give you something that we track, and again, this is highly regulated, but it's about getting from the number, or getting from the net metric, and internalizing it to your staff where it's a pride issue. So for instance, urinary tract infection, mostly nursing owns that, physicians to a little extent, but I'll give you a story. Just yesterday I was touring and I said, how was safety huddle today? And the nurse leader said, I'm so embarrassed. And I said, you're so embarrassed. Why are you embarrassed about safety huddle? And she said, Margaret, we haven't had a urinary tract infection in this hospital for 293 days. And we had one. And it was, it was something that we missed. And so the mere fact that it was visceral to the nursing staff, and the nursing staff said, yes, can you believe that we were almost to a year? And I mean, that's what you want, right? That's what you want with lean leadership. You want people to sort of ingest that, to say, yes, this is my metric, but it's not just a metric. It's how I am viewed as a professional going forward and doing good things. And so the board chair was touring with me, and the board chair said, well, Margaret, you're new here, but we were the best hospital in the Sparrow system because our last metric was 412 days without a urinary tract infection. So it's that whole thing of, we're gonna look at the best because here's what the metric is that we need to hit, but we've overachieved it.
Mm-hmm. I think that, yeah, that's great. You know when it's working and there's safety, right? When you were thinking at that particular level. So you had mentioned some of the algorithms and so on. So I'm sure you have some rather sophisticated data science systems in the healthcare system there. But can you talk with us about technology? Is technology, as it's developing, does it help or hinder your leadership work? If so, how? I mean, and some people in certain professions say, well, I don't know, maybe AI will replace me. And I just wonder if you ever have those thoughts about the future of technology and what it might mean within healthcare.
I think AI and the advancement of technology can only help in healthcare. I don't think a nurse is ever going to be replaced by a droid, at least not in the next 100 years. But what we can do with AI is help the professionals that now. So I'll give you. You may know this already, but the typical care giver, whether it's a physician or a PA or a nurse practitioner or a nurse, at least 50% of their clinical time is spent away from the patient because they're charting, they're documenting.
Mm-hmm.
There's new technology that literally they can go into the room. They have a microphone and it's ambient technology, and they can be talking to the patient, and that technology translates into the required documentation in the medical record. So they're covering everything, but they're not having to take 30
Yeah.
minutes per patient they see to sit and document.
Mm-hmm. I mean, that is just wonderful. I mean, and plus, it's not just the efficiency and the time, but it's also the effort it takes that specialist, that highly paid individual to
Mm.
spend time documenting, which is a non-value added operation for instead of having talking to the patient, seeing the patient, doing their critical thinking and so on. So that's really great.
Well, the other thing is you can record it, and you can, because your phone is actually picking it up and then transmitting to the medical record. But if the patient's family wants a transcript, let's say a discharge summary, and the patient has dementia, right? And you're talking to the patient, but the family isn't there, you can give that recorded, sort of methodology to the patient's family, to say, because it's not part of the medical record yet, it's just a conversation, and so it's not protected health information. You
Mm-hmm.
can share that with the family. Here's what I told your father. He needs to walk with a walker or cane. He can't walk independently. He needs to do self-care in the bathroom every 2 hours. He can't wait every 4 hours. And, just examples of how technology can be so different. Yes, it may diminish jobs in the auto industry, but in healthcare, I believe that it can only assist.
Mm-hmm. That's really interesting. So, as we're talking about technology and you're looking to the future, and I know as president, you have a vision for what's possible. And, I mean, it's continuous improvement. We're always working to get there. But what would some of your hopes and goals and dreams and vision be for your employees, your teams, your organization? There's always untapped bandwidth somewhere. And we know that, when we go on lean journeys and recognize the waste that we accept and don't see until we do see it, then it's an incredible experience. But what would you say is left untapped, and what is your vision? Where are you heading?
So I'm going to surprise you with this. I think that because of the healthcare shortage with jobs and positions, I think the way we're looking at our workforce and the metrics that we're using, they're dated. They're in a mode of a generation that has come and gone.
Mm-hmm.
It's not like looking in the electronic want ads or going on Indeed. It's we've got to go after them. So my hopes and dreams for healthcare, and looking at, hospitals are mini cities. People say, when I say, oh, I work in healthcare, of course they say, oh, are you a nurse? No, I'm not a nurse. But again, people think of healthcare as nursing and doctors. I mean, we employ we employ carpenters, plumbers, dietitians, chefs, you name it. So I just had a conversation this week, and we're planning on looking at innovative, what I would call metric-driven recruitment of students in the 9th grade. So
Wow.
get them in the 9th grade,
Mhm.
and then we're going to track that with metrics. How many students have we in the 9th and 10th grade? We'll bus them to the hospital to get them, just exposed to the healthcare environment. And one of our faculty, if you will, it could be a pharmacist, it could be, physical therapists. They're going to come in and show the 9th graders what's going on. And those 9th graders are going to come every month. So we're going to track it, and then we're going to give them scrubs that they can wear. So we get not only to the metrics, but the emotional piece of, wow, I could be, fitting in something bigger. Right. And then now we're probably going to start this within the next year. But my hopes and dreams are that 20 years from now, the workforce for healthcare, at least in the geographic area I'm in, has been totally transformed, because we're getting those students early on, and they have that microwave mentality of, oh, I want to be, how can I do this quickly? Well, we can get you a licensed job in healthcare at age 18, and then we can pay your tuition as you go to community, so it's not this big, hairy, audacious goal like, wow, I'm going to spend $100,000 on a bachelor's and I don't know whether I'm going to have a job or not. It's getting them in there, getting them interested, and then tracking where we are and tweaking the process, sort of like the plan, do, adjust and move
Check it.
forward.
Yeah, for sure. No, that that's very, very interesting. And I know that worker shortage, employee shortage, workforce shortage is one that is being addressed in all industries, from aerospace, like you say, to healthcare. And you're absolutely right. We have to do something different and understand how to reach those kiddos that are going to end up being our future. So I love that idea. That's just great. So you obviously, in your very humble way, have exuded what a powerful leader you are in these two interviews. Can you tell us how you see yourself in terms of what strengths do you possess as a leader, and how do those strengths impact your organization? What is the connection there? How do you see yourself, and then how do you see yourself impacting the organization?
So that's a complex question. Let me just say that my inner self always says I'm not doing enough, and I'm not, I'm not achieving enough. So I have that endless drive of, we can do better. We can do better with quality. We can do better with retention of staff, those types of things. But really, my philosophy is, I'm there to serve the people that are doing the work. I'm not there for self-gratification. I think that leaders sometimes say I too much, and they don't say we, and they don't give gratitude and humility where it should be, rather than pumping up their own resumes and CVs. So I would say that um, my my leadership style is to ask the why at least 5 times.
Hmm.
Um, you know, why are you frustrated? Well, because we're short staffed. Okay, how long have you been, why are you short staffed? And then just get to understand what the issue is, and then partner with the people that are facing that problem, partner with them to look for solution based scenario, and then carry it out. I think a lot of people, this is my own, a lot of people, a lot of leaders talk about change, but they don't do it.
Yeah, they
Um,
don't really understand it, how to do it.
right. And they expect others to do it. But when, when you're getting tasked to do things and you're already overwhelmed, and the president of the hospital is, golfing every other day, you just have a bad taste in your mouth about, the disconnect between senior leadership and you on the floor doing your job. And I really believe that you've got to be, I shadow people in their jobs. I I spent a day with a housekeeper, and I said to her at the end of the day, oh my God, I don't know how you do this. I want to go home and take a nap. I mean, I mopped floors and cleaned 3 ORs, and I thought I was going to have to crawl to my car. So we have to seek to understand, always seek to understand, and then have the humility to say, thank you. Now I understand.
Mm-hmm. That is so, so powerful. So, in thinking of where you've started and where you are now as a lean leader, can you share with us one or two of your proudest moments as a lean leader? What are you most proud of?
Um, I am most proud of the fact I don't know how to say this, but I'm most proud of the fact that I get emails from not only nurses, but people in the kitchen, um, you know, carpenters, that when I walk the halls, people know my name. The emails are, Margaret, did you know that the
Oh.
bathroom in our, in our break room has been broken for 6 months? The fact that they trust me,
Mm-hmm.
the fact that they feel that they can reach out to me, and the fact that I could possibly make a difference in their lives.
No, that's wonderful. Um, and I just think initially as a social worker, you just are so talented in that way anyway, and it's just so cool to see it in the ranks there of, the executive suite, and how you are just so true to yourself about all of that. So there must be things that bother you as a lean leader. What are you most concerned about? You mentioned the workforce shortage and your thoughts on that for the future. What else are you concerned about as a lean leader? And what are some things that truly are perplexing? I mean, lean is always about that question that you ask, the 5 whys. And so
Yeah.
that's not a safe place to be. There's always something there. So what are you concerned about the most?
Well, I think, again, lean is not immediate. Lean is a process. And if you want to be successful, you've got to follow the process to get, if you want to get to 0 defects and you're at 50% defects, with the process improvement and what you plan to change, you're not going to get there next week or even next month. What we have now in our cultures, in many of our cultures, and especially in the business cultures, is what I would call microwave thinking. That, I'm going to do this for a short-term fix, but it really isn't fixing it. It's kind of like the Band-Aid effect. So when you think of short-term fixes and you haven't fixed the causal reason of the defect, then you're going to dig yourself deeper in the hole. So I worry about that in not only healthcare, but in other organizations. I mean, if you look at General Electric, and you'll remember this, Jack Walsh was touted as, the great leader of the time because of transformation. And as you know, the finances they were borrowing, and,
Mm.
it was the back room. And now GE sort of went out of business, and it's not a US company. The Chinese bought it out. So not that that's bad, but I'm saying you can't, you've got to get to the core. And that's what lean does. It gets to the core of the issue rather than treating the symptoms.
Mm-hmm. No, I think that's great. And like you say, that microwave thinking just permeates our society. Take a pill, put on this lipstick, drive this car. You think you're gonna solve things. And there's no such thing till you get to that darn old root cause, right? So
Right.
that's great. Is there something that when you look at your leadership practice, you say, this is what I need to improve and work on in the future? Are there any areas that you're thinking about gaining more mastery in?
I'm always trying to gain mastery. I think, again, what what I need to learn more about is the evolving technology and AI that will be impacting healthcare, because we have to get we have to get ahead of the curve to be able to predict it, right? And and I'm not savvy enough to know the intricacies of what's going to be sort of the norm in 10 years.
Yeah, I think that's a real challenge, and what a fast moving area of growth, so there's plenty to learn, and, you can come at it from so many different points of view, for sure, to try to learn about it. But I think that's really interesting. And I think it models, you just have to be a lifelong learner. You don't know what's going to be coming your way. Um,
Well,
I'm sorry, go
well,
ahead.
no, I mean, when you think about it, what we're building now, we're building for obsolescence. So for instance, 10 years ago, people were still building orthopedic units in their hospitals
Mm,
because 10 years ago it was 80% inpatient, 20% outpatient. Now it's 80 to 90% outpatient.
mhm.
So what they were building literally a decade ago is now obsolete. So, you know, where is healthcare going to go, and how does that impact, technology, population health? I mean, the University of Michigan is piloting hospital at home. So rather than patients coming to the
Yeah.
hospital's going to you. There's going to be, a team that comes to your house, especially for the chronic diseases. So what does that look like with the payer structure, the reimbursement, the workforce changes that you're going to need, and then the technology that you'll require?
Yeah, I think that is really interesting. I know several years ago I was involved in a project with Health and Human Services through the state of Michigan, and it's how do we get close to the customer, and that creates, instead of pushing them so that they come to us, how do we get closer to them? And so I think that's a really very interesting concept, and certainly found it in Lean for sure. So, if you're now just thinking about like every day, this past week, this next coming week, are there typical barriers? Do you see any kind of a pattern in the work that you do as a lean leader in healthcare? That you could say, are like typical barriers? I'm always highly tuned into this and trying to look out for these barriers that I've seen over and over and over again. Are there any lessons you can share from us on that point?
I think in healthcare, especially with level one trauma centers, which I'm a part of now, the lack of predictability of trauma, um, is you can never plan that, right? You can't plan a snowstorm where there's going to be a 35 car pileup where
Mhm.
you're now going to be treating 100 car accident victims in your ED. We didn't anticipate the MSU shootings that all came to the ED, and then all the emotional pieces with that. So I think the lack of predictability, because lean is all about, metrics and prediction, and but we still believe in healthcare that the full moon is a true thing with ER. So
Yeah, as a former high school principal, I believe in that as well.
yeah, so how do you predict what's going to happen on the full moon days? Um,
Sure.
so I think at least in healthcare, you have areas of predictability like the operative room. 80% of your operations or your surgeries are planned well in advance. But then there's that trauma that you suspend all your planned and you're operating for 2 days on accident victims or we just had a huge fire outside our ER yesterday. Thankfully, everyone is okay, but it's that kind of like total out of the blue
Yeah.
circumstance that you've got to then make sense of and get the right resources at the right time to that unplanned event.
Hmm. Yeah, and some of them are as large as what we call a black swan, but what you're describing is really just the predictability of the unpredictable,
Yeah. Yeah.
which really doesn't make it a black swan. I mean, outside of COVID or something massive like that. But yeah, that is a really interesting mindset to have for sure. So, if you were to just describe to us the daily practice, the best practices on a daily basis of a lean leader, what does that look like? And you've told us some of the things that you do, with your huddles, safety huddles, and so on. What kinds of things should lean leaders think about routinizing, and as a part of their day to be effective? What does best practice look like? Can you walk us through that? Some things that are on your mind at the beginning, middle, and end of the day, things you want to make sure that you do or think about.
So I think there's structure, there's process, and then there's anticipated and real outcomes. Um, so I would say in the beginning of the day, I start my day at 6 o'clock in the morning, looking at all the metrics of the day before: number of patient falls, census in the ED, number of surgeries, and then look at, we have every day where we didn't do a good job. Um, any what we call safety situations. So I start the day, and then part of my day is contacting people to say, what was the rationale behind this variability, right? And then how can we, and again, part of the safety huddle, how do we fix that immediately? Or is this a bigger project? And so if it's a bigger project, what resources, the who, what, and when do we need to tackle the problem? And then really looking at, and not only the day to day, but how do you look at strategy and combine that with your lean thinking in operations? So I think there always has to be strategy. For instance, in Michigan, we have, so as you're going through your lean leadership, you've also got to think about growth. You've got to think about connecting your demand with a solution. So for instance, we have in any day, because we're sort of in an urban environment, in our ED, we have 58 beds, and we have, up to 40 patients that have mental health taking up the beds that others would have, which creates a hallway situation. So you're looking at those daily metrics, but you've got to plan ahead in terms of how do you take those metrics and do strategy. So we're working with a third party to try and build on campus a psychiatric facility for adolescents and adults in a partnership. So kind of like current state, near future, and then the future in terms of really 10 miles down the road and how to fix the current problem.
I think that's really interesting because, most people would think the first thing I have to do is check all my email. What you're doing is you're looking at data to begin the day. And then that sets up I'm not saying you're not looking at email, but that, using that data-driven decision-making for the day, both in terms of immediate, midterm, and long-term thinking, is a very, very interesting routine, I think, for lean leaders to consider. So thanks for sharing that. When you look around you, and we talked in the last interview about some of your mentors and people who have been critical in helping you on the path that you ended up on, which you never thought you would be on. And when you look around you, are there things that you see in leaders that are very exciting or that make you cringe? And maybe even more specifically, do you have a lean leadership hero, not just somebody who mentors you or helped you as your career developed, but a specific example of someone who when you look at what they do and how they're making decisions and presenting themselves and the tools and thinking that they're using, you say, that's the way that I want to go, and this is a model for me. Can you share with us, about the best maybe and the most cringeworthy and, what that hero might look like?
So, yeah, I mean, in terms of lean education and sort of giving me the awe of lean, you have two faculty that were on your program that I worked with in a hospital, and one is currently running a program at Oakland University for companies that want lean and is selling lean every day. So I've had both those leaders help me in projects to make a difference, and they're very different personalities. One is a has been in lean, I think was involved with, the Chrysler exec in the supply chain that wanted to go with lean, and his whole life is lean. I have another person who actually was, an executive who picked lean up after he had an early retirement, and has that business mind and knows the business, and moves things forward despite the obstacles. And having worked with both of them, and I take a little bit of both of their secret sauce, and
Sure.
because um, you know if you're in what I would call the academic mode of lean, where you're going to bring a team in and you're going to do it, that's fine. Or if you teach lean, that's good. But it sometimes misses that real world urgency. Like, no, I have a problem. I got to fix it now. My boss is on me. How can you do this in 30 days? So the other person, he gets that. So he tempers the project with, hey, here's the deal. This is a long process, but we're going to give you some early wins. So you can say that this lean process is the way we need to go.
Yeah.
Uh, so, so those are my two lean leaders. I would say my overall, something that's really impacted my career actually is the person that I work with from the University of Michigan right now, Dr. David Miller. He is one of the most insightful, humble. He's a surgeon. So humility is a trait that he must have been born with. But he teaches me how to be a better leader. And he does that with grace and kindness and insight, and giving me examples of how they too have had that problem and what they've done. So it's more of a teaching relationship. It's more of a mentoring relationship rather than you go do this.
Mhm.
And I can't tell you how my job satisfaction has completely changed reporting to someone like that.
Oh, that's fantastic. That's really fantastic. So we'll leave it at that and move on to the making the business case for lean leadership. And can you tell us, why should someone put in the time and effort to learn to be a lean leader? It's not an easy journey. It takes some time to learn and become acclimated. Just with the tools alone and the thinking routines requires a lot of discipline. You've obviously been at this a long time, Margaret, and there must be something there that makes the business case for lean leaders to pursue this journey. What is the return on investment for becoming a lean leader? What does that look like? And I'm not just talking, bottom line, but there's, outcomes all over, all over the ecosystem of a great lean leader. And can you tell us what some of those have been for you to help us to understand the business case?
So the business case basically is, you can go the traditional route and try and fix the problem by bringing in a consultant, and your board will be happy. Your constituents or your shareholders will be happy, but you haven't fixed the problem. So if you want to look at the benefits of lean leadership, you have to look at a multi-year savings or a multi-year return on investment. And a lot of people don't want to wait that long. That's why I said it's a microwave piece. But we're starting to employ lean leadership right now in the organization that I'm in. And not only are we changing the metrics, but we are changing the culture. And our retention rate in the last 6 months, by looking at process, not people, at getting improvement teams together and looking in the Gemba walks and looking at the metrics, it takes this from, oh God, this has always been a problem, to guess what? We're going to chunk it down and we are making a difference. Look, we fixed this. Let's go on to something else. So it gets that energy going in your workforce, and then it becomes contagious. People want to, so I've had people say, can you send me to, how do I learn lean? How do I put those principles? Can you tell me again how to do an A3? So it energizes the culture and turns it more into a team culture than you do it, or it's all about me kind of thing.
Mhm. Yeah, I think that's great. We certainly understand the value of developing that social capital, which a large amounts of it are untapped in our organizations, and lean really can help to unlock that. So thanks for pointing that out. So what would be the most value added decision making, thinking routine, interaction mode that a lean leader could engage in to get to that, making the business case for lean? What does that look like?
So I'll give you a real life example. A hospital that I came to, and it was a turnaround situation. The example that I gave you, where I was the fourth in a year. Most of the doctors had given up on the hospital, and so we had like 6 or 7 surgeries a day. Well, if you know healthcare, the OR is one of your revenue engines. Uh,
Mm-hmm.
Brought in uh, Oakland University lean consultant. It wasn't a month, it wasn't 2 months, it was 14 months. And people thought I was nuts. But I just talked to the person, one of the doctors that we recruited after we put the lean process together and hardwired it and involved the entire OR in the change. And where the average number of surgeries per day has quadrupled, and that is long term. I haven't been there in 3 years, and talked to one of the surgical leaders, and they said, nope, we're still having, Dr. So and so from the other hospital. He's still here. So we did something right, and it stuck. And
Mm-hmm.
that is the long term success that you can count on with lean, because if you look at the processes and you look at the metrics and you look at the before and the current and the after, that's not something we could have done if we brought in a surgical consultant who would have told us to, tweak around the rooms or
Mm-hmm.
put brighter lights in the ORs. That isn't what it was about. It was essentially changing the workflow and the culture in the OR to be the best they could. And their indices show it. Their turnaround time, their surgical site infections are so low. It is, it's a success story. It really is.
Mm-hmm. Yeah, anytime you can quadruple any kind of a, business operation that's produces revenue and profits, that's a great story for sure. So, in terms of reflecting on your lessons learned, if someone were to sit down with you and say, Margaret, what do I need to take away from this message that you're carrying as a lean leader that would be the most honest, realistic advice that you could give to someone who is seeking to also become a successful lean leader? What is that advice that you would share?
So my advice would be that you really you adopt the fact that you're going to lean, and you incorporate the what I would call the not only the metrics, but the learnings of lean and the different style you must take in your leadership journey to be able to create a culture of lean, create the success of lean, and then move it forward. If you start small in your leadership journey and you get a win, then it cascades on throughout the organization. And honestly, to your point, I didn't even think about the fact, yes, I start every morning, and it's not conscious, but it's part of the how you perform as a lean leader. I look at metrics every morning. Probably before I really understood lean 20 years ago, I would have done my emails every
Yeah.
morning, right? So it changes the way you think, and you change the way others think.
Yeah, I think that's great. And like you say, this idea that, you've got to be willing to just go into it, take the lessons learned and keep moving forward. It's not an event, it's definitely a journey.
Yep.
Well, we're wrapping up here, and I just wondered if there were any other closing thoughts you'd like to leave with us regarding lean leadership, and your journey.
Well, I think again, if you're a leader listening, or if you're a leader reading this, we've got one shot in our career to make a difference. And I would not have been successful in my career had I not incorporated lean into my leadership strategies in my day-to-day life.
Yeah, what a great summary, Margaret. Thank you so much for sharing your thoughts and your experiences with us. We appreciate the transparency with which you did it. And uh, also want to say, as the mayor of the U of M Health Regional Network of the city there that exists there, and of course, as the president of that wonderful organization. Thank you so much. And hopefully we'll be hearing more from you soon. Thank you, Margaret.
Thank you, Shannon. Take care.